But if we're rushing people through, like, what's the chances of like that 45-year-old kind of, 45-year-old male who really doesn't dig going to the doctor be like, oh, by the way, do you pee your pants when you stand up? And they're
Right.
like the no is out of their mouth before they even think about the question, right? And that's misdiagnosis. That's a false negative, you know?
Yeah, I mean, I see it all the time with we have to ask the tough questions, right?
Yeah.
And I think by them knowing they're going to get better care and having a good relationship with us,
Mm-hmm.
it opens up those doors of, being honest when I ask about your vaginal dryness or,
Yeah.
being feeling comfortable enough to have those kind of difficult conversations or just like
Yeah.
really like intimate things. Definitely having that foundation with our patients is critical
Yeah.
there.
Yeah. That's actually why I wanted to schedule this interview, is because I know that you're pretty good about posting on social media. And I know you've encountered some people like this in the last 6 months where it appears they revealed some information to you that they most likely never revealed to another medical provider. They slowed down enough to talk to you about like what's really going on or what's really scaring them. Not necessarily the surface level symptoms, but what does this mean for me for the rest of my life? I see it in back pain, like, oh, will I never be able to play with my kids again? But I'm sure you see some versions that are equally or even more scary about, will I ever be able to blank again? And that's kind of what I wanted to dive in is, what do you hear and what are some common themes and maybe some takeaways of how we can pull that information out of our patients? Because when we do, what I have found is when you're the only person that finally admitted their real fear to, and you do a pretty good job, they're really connected to you. Like, really, because no one ever has gone into that ninth circle of trust,
Imagine a practice where patient engagement is seamless and unified. With TrustDrivenCare, connect with patients across text, email, social media, and Google Business Chat, all on autopilot. Empower your team to step in effortlessly and engage in real time from anywhere. Say goodbye to multiple software and hello to a simplified practice and life. TrustDrivenCare is the all-in-one solution to save time, boost revenue, and build patient loyalty. Book your demo today and watch your schedule start to fill up. Now, back to the show.
Yeah, I think either they reveal things or because we have more time and that kind of thing, we ask the questions that have never been asked before. I think that's what happens more often in my situation where
Okay.
I ask about, do you have painful intercourse? Or, do you experience dryness? And they kind of think about, they're like, yeah. And I'm like, okay. They're like, well, why has nobody asked me about this to do with menopause before? And I'm like, well, no one's taken the time to ask you the right questions, right? And then they're like, oh yeah, I thought that was just normal.
Yeah.
I'm sure you hear that, right? Like, isn't back pain part of aging, right? Or, I thought that,
My dad had it. My uncle had it. I just, it's hereditary.
right? Or, oh yeah, my mom had these mood swings too. And
Yeah.
it's our family. And I'm like, yeah, but like, we can do something about that. Or it's not normal. Yeah, you're going through, or I tell them like, yeah, you're in perimenopause right now. And they're like, oh, am I? And then you sort of get to educate on that and talk about that more and then, go through all the symptoms. Now, I mean, I'm in a position now, it's 2025. I think menopause is being talked about a lot more. So people aren't quite always as oblivious just with the conversations nowadays. Social media helps, right? And, once you start, your algorithm, once you start looking up one thing, it speeds you, right? So I have patients come in and ask me like, am I in menopause or what is this? And they want to know more, right? So
You are not, but I know that you got hit by it.
yeah. Yeah. We have other issues on that side.
Yeah.
But yeah, no, I think the conversation's better. People are talking about things more, which is great. They just need providers that they trust and are going to offer that care for them.
Yeah. Yeah. So I would love to hear if you guys zoom out and look at successful conversations where you do ask those tough questions and you feel like you are truly getting the honest answer and you can always tell by like the pause right before they answer.
Totally.
If they answer right away, it's like with my kids, I've learned if I'm like, hey, did you do your homework? Yep. It's like, you answered that too.
You
Yeah.
absolutely did not.
Yeah. Yeah, exactly.
I mean, I've been there. I've said that. Yeah, of course I have.
Oh yeah. We all have. But when you look at those ones that do answer honestly and are willing to kind of dive deep with you,
Yeah.
how do you set that up? How do you recommend to people, hey, if you do these steps, it's likely you'll get more success?
Yeah. As a provider, I think the first thing is that it's so important to listen first. My favorite thing I say to patients, okay, you're coming in for this. Tell me about it. Just give them the time. Give them that couple minutes to just talk. to just say it, right? And I mean, thankfully now with AI charting and stuff, it's really easy for us. But I just say, tell me about that. What's going on? And then they generally can go off for a couple minutes. And then we have the ability to either, dig a little further, inquire a little more about something, ask a follow-up question. But I think when patients feel like they're listened to and heard, and not just you sitting there like head down typing away, but really like engaged and there and present, that makes such a world of a difference for them, because they're like, oh, you're actually taking the time, like you care. It just shows you care.
Yeah.
And I think starting with that is like immediately, if you're not listening, that there goes your any sort of hope of establishing a relationship or, building that trust. It's gone. If you're not listening and they feel like you're not listening,
Yeah.
game over.
Yeah, it's funny. We talk about this all the time. I don't know if you know this, but your answer aligns perfectly with the research on PubMed.
Yeah.
So Emma is evidence-based, but the other side is like the number one complaint in the research we've looked at, like 80 articles, is no one ever listened to me and nobody ever heard. Mm-hmm. And the flip side that you can see in this is I would love to dive into like your Google reviews of patients, because when they are listened to, that is one of the most common things they talk about. They'll talk about the cleanliness in the office. They'll talk about if you're on time or not. And the third thing is whether or not they were listened to. And so they use words like they don't rush you through. They actually listen to you, which is interesting because you could take those patients and be like, if you rushed them through or listened to them, maybe they both end up getting an antibiotic, right? Like the treatment is no different. However, their belief in the treatment, their willingness to come back, their willingness to complete that antibiotic, like, compliance is like a huge issue with that.
Thanks for tuning in to this episode of Trust Driven Insights, brought to you by TrustDrivenCare. Imagine a world where all your patient communication is in one place, seamless, effortless, and on autopilot. That's the power of TrustDrivenCare. If you're ready to streamline your practice, check out TrustDrivenCare.com and see what's possible. Trust Driven Insights. Real conversations. Smarter care. Stronger business.